Hi everybody. So this past week I went for my I guess biopsy / drainage of my cyst that I told you about. So when the radiologist came in to do the procedure, he came in and he told me that the reason why they wanted to take a sample was because the fluid inside the cyst was murky. See, I didn't know that. When I had left that day, I thought that they were going to just drain it because it was so large. And then I did some reading online and it said that a cyst needs to be drained if it's large, and a biopsy will be done if there's any question about the fluid within the cyst. And if there's blood or if it's murky and whatnot, then there's a chance that it could be cancerous. So he then told me right that day that the fluid, according to the ultrasound, showed that it was murky, or film, murky I guess is the right word. So I'm so happy I did not know that for the past week. Otherwise I would have been really, really nervous. So I said, okay. And he said, okay, we'll take some fluid and then we'll send it off to the lab to find out what it is. And then I asked him, will the cyst, will the lump go away then once it's drained and you take the biopsy? And he said yes, but only if it's not also known as a milk cyst. He said if it's a milk cyst, it will fill back up. And I asked, well, how long does that take? And he said it'll happen instantly because I'm still breastfeeding. I'm like, okay, well that's really interesting. So he ended up, they were able to freeze the breast, which is wonderful because I would assume it would hurt. And the freezing felt like as if, like a vaccination or when you get a needle in your mouth. So it pinched, but it wasn't too bad. After you have, ripped nipples or, any of that type of stuff, or mastitis, pain in that region takes on a new meaning. So the freezing took, and then instantly he went in with the syringe to do the biopsy, and they showed it on the ultrasound because they find it with the ultrasound first. But I didn't watch because I get a little heebie-jeebie-ish about that stuff. So I didn't watch that. And so they drained it, and I kind of just looked away at the other side of the room. And then all of a sudden he started counting to 10. And he goes, oh, it's full. I'm like, what? He goes, your cyst is full again, so it means that it is a milk cyst. So I thought that, that is going to be pretty good news. I was pleased. I think if you're going to have a cyst that's not filled with clear fluid or healthy normal cyst fluid, a milk cyst is the way to go, because the other kind, it's a good chance that your cyst is cancerous. So that's what I have. I have a milk cyst. Ta-da! Finally have the diagnosis. So it's full again, and I can feel it. So what he also then went and did is he took samples of the tissue around the cyst. So the fluid's being checked and the tissue samples are being checked. So now I have to wait 3 to 5 days, and I'll get a call from the office, and then I go in and meet with their specialist, and we'll talk about the findings. More than likely it's absolutely fine. This is something that just comes when your milk comes in, and then it's supposed to just go away and disappear when your milk is done. But of course, like everything, they need to check it, because there's always that 0.05% chance that it's cancerous. As far as afterwards, breastfeeding was fine. No pain or discomfort with it whatsoever. I ended up getting a little bit of a bruise, but again, that's fine. The rest of the day there was a dull ache, but nothing that you needed to take Tylenol or anything for. The only thing you had to do that was slightly irritating was you had to wear a bandage, like a normal band-aid on it, for 2 days after the procedure. And my skin has a bit of reaction to the adhesiveness of band-aids, so I have all these red rectangles burnt in to my skin, which will probably take about a week to clear up. So, but it could have been a lot worse, so it's good. But so now there you go, you're updated. Milk cyst, good to know. I had never ever heard of that before. So if you have a lump that just, I guess, appears while breastfeeding that you didn't think you had before, definitely still go to your doctor and talk to them about it. But I think I would have had a little more peace of mind knowing that that is even an option that could occur. So yeah, I guess you learn something new all the time. Like my doctor didn't even mention to me that that even exists. And when I look online, when you look under cysts, it doesn't even talk about milk cysts, that could be one of the reasons why you have one. And you have to kind of Google in milk cyst specifically, and then it shows up. So anyways, there you go. I guess I will update you again with it once I have my appointment with them, and fingers crossed get the official all clear. Okay, talk to you later. Bye-bye.